Welcome to today's webinar, Mastering Change Management, Process Improvement, Best Practices for Hospitals. In this session, we will explore the essential strategies and methodologies that can help hospitals effectively manage change and drive performance improvement. Change is inevitable in any healthcare setting, and your bosses are going to throw a bunch of projects at you, but do you really know how to manage that change? So understanding how to navigate it can significantly impact your care delivery, operational efficiency, and your patient satisfaction. So as you can see, we have compiled a great panel. So I'm going to go ahead and jump in. So Candy, I'm interested for you to describe some performance or process improvement projects you currently have going on and why you feel they need to be managed versus just making a change. Like, why even bother manage? Let's just go tell people to do things.
Right. Well, sometimes we do just go and tell people to do things, but when particularly whenever we are making a change to a system or to a workflow or a process, if we're not really all in on that change management and have a good methodology down for how we roll out the change, we just find that those changes tend to not stick, or you end up with something unintended as the end result. So I think traditionally here at USA Health, our project management office has been managed by our IT department, right? Because that's what we all think of is we have system changes or we have new technologies that are being implemented by our teams. We typically follow the Waterfall change methodology where you get a spec, you do some analysis, you say, yeah, we think we can meet that spec. Then you design, you build it, and then you test it and you roll it out to operations and it's live. And a lot of times, historically, that's kind of where the process has ended. I think that particularly with a lot of the projects that we have been taking on over the course of the past 2 years, 3 years, the changes have come so quickly and in such volume that we've had no choice but to kind of rethink, particularly in the operations space, our methodologies. And revenue cycle, we really find that Scrum works pretty well because they're bite-sized chunks. We can move really quickly in little 2-week timeframes or 4-week timeframes and make some impactful changes and monitor them. And if something changes in the meantime, we have a chance to be flexible, whereby that more traditional process doesn't allow for a lot of change necessarily. It's really hard to steer the ship in a different direction. A couple of the things that we have taken on recently that we've used a blend of the two methods. The first is we did a complete revamp and re-rollout of our charge audit and reconciliation processes for our clinical areas. We utilize Cerner Millennium as our EHR. And so that is a major foundational element of the use of that system. It's a very leaky EHR from a revenue perspective if you don't have that piece in place. And it's essentially where clinicians have the onus of telling kind of all the support departments what charges should be on an account and the review of those charges, ownership on the clinical team. In practice, what all of us in revenue cycle have done prior. So out of that re-rollout of that project, we've come up with a subset of 25 to 30 additional projects where we need to go back to a process or a technology and make changes there. So it's continually evolving. I don't know that we'll ever be done with it. We'll just continue to tweak and identify more projects that need to be done out of it. But that's kind of our methodology that we use. And currently we're working on all 25 subsets, everything from looking at specific lab orders and what's attached to drop charges and trying to make it as easy on the front end for the clinician so they're not adding steps to capture revenue. We're just attaching the revenue triggers to the documentation that they're already doing, if that makes sense.
So Candy, thank you for that. And question for you. So managing versus just making a change. Some of the things that you think about related to actually managing a project, like things that come into my mind are kind of like, oh, I think this is going to work. We're going to make this change, but you have to manage it and see if people are adapting to it. Are they actually, does it have the desired effect that you want? Is it creating more work for physicians or for staff or whatever? So in my mind, thinking about that managing. Do you have any other thoughts on that?
Yeah. But the first is that if you do not think through how you're going to measure the impact of the change that you're making, you might as well not make the change. That process by which you are defining what success is, defining how you're going to measure it, and where you anticipate that change putting you, it's paramount to the project. And then where I think that, if I'm just Erin, where we struggle here sometimes is in the communication of that change, the why behind it, right? A lot of folks, if they don't understand the why we're making a change, your chances of actually executing cleanly are severely inhibited. So it's an area where we are aware that we need to probably do a better job of proactively communicating changes and then the reason for the changes. We don't just make changes to make things more difficult, or we do try to be very proactive. There are times when there is no choice. You have to be reactive. We have, something that occurs outside of our control and we have to react to it. But we really do try to take a much more proactive stance. We are working on the communication, and then on the back end, what we have gotten better at is rounding on the areas that have been impacted by the change and making sure that what we intended to design is actually how it works. We find things every day just through that rounding and checking up that there are areas where something hasn't been rolled out completely, or we're waiting for everybody in the department to be trained before we gain access for the people who have been trained. That doesn't work. We discovered that this morning in one of our rounding sessions. And so your success in being able to fully implement and execute a change cleanly is that communication, and that constant check back, I think, is probably the most important.
I would agree. I do think making sure that the change actually happened and that they're doing it correctly and it's communicated. So I'm going to go to Jason and see, do you have anything to add why you need to manage a project just versus making a change?
I think what Candy mentioned, that's one of the critical pieces, right? That in healthcare and in many organizations, our organizations are complex. If it's a simple change, a good communication method or good communication email can normally handle any of that change. But when you start getting into intermediate and complex change, and when you're dealing with large organizations or matrix organizations, communication becomes even more critical, and making sure that there's a process for ensuring that everybody not only understands what the change is, but actually had the change communicated to their group and how it impacts their group. I think that becomes critically important. So it has to be a managed process. It can't be just something that we do on a whim. There has to be a lot of planning because there's so many more people that have to be part of that change, and they have to understand what their part is within that change, how they can ensure that it occurs. I mean, just even starting something as simple as a new clinic involves so many different departments. Starting up a new service line, that involves so many different people. So you have to manage those pieces because a simple email, when people get hundreds of emails a day, or a simple phone call when people have tons of meetings and normally are double and triple booked, there's just no way pure communication alone is going to help make that change occur.
I agree. I think you hit the nail on the head. I think any process change can affect so many different people. And even if you try to think of them all, you probably miss some, but great input there. Ryan, do you have anything, or I'll move on to the next question here?
No, I mean, other than to kind of dogpile a little bit, and I think to kind of reiterate, part of the reason you manage it is because, quite frankly, foundationally, there are people involved. If this was simply a computer to computer type of thing with no real emotions, feelings, or opinions about what you're changing, we just make the change. But there are people involved. And so I think, there are a couple of things. I think, of course, the communication is certainly very important. But I think what Candy hit on was really good, too. And I think is going to play as we start talking more about kind of this AI revolution is going to be the why. In any project, big, small, or otherwise, to a degree, those that are running it can't ignore or be naive to the culture you have in your organization. Because I've seen across the country, when you've seen one organization, you've seen one organization. And there are some where with change management, it's people tend to be more flexible, but then there are some where you end up with people that are very protective about what they do and find that their contribution and their job security is based on what they can control, hoard, and do themselves that is unique to anybody else, because nobody else can do it. So when you're making changes, especially to those folks that may be a little more protective of their roles, I think that's really where not only does good change management come in, but great communication. And I think really explaining the why becomes even more important.
The truth of the matter is occasionally, sometimes on a project, you don't always get it right. You miss a chunk of folks, or you miss an entire process. And so that's why I say even, that prospective communication is really important, but following up on it afterwards is sometimes even more important. I mean, the perfect example, I spoke about this morning, we found an issue. It's a part of a conversion. When you start getting into some of these humongous projects, like a full system conversion, there are going to be misses. There are always misses. And none of the EHRs, none of this, I don't care what system it is. The more complex the system, the more difficult it is to make sure that you hit the mark and cross every T and dot every I, no matter how good of an organization that you have, no matter how good of a department that you have running it.
Well, but I'll to dogpile on that, I'll just say that is where a little bit of culture comes into play, because we have being tied to, and you're the same way, Candy, being tied to an academic organization. We always talk about we got to be okay with failure. How does your culture and your organization handle failure? Because the reality is, we're going to fail. We're not going to always take the perfect step. And quite frankly, I think a lot of times we prevent ourselves from taking steps because we're concerned about not taking the perfect one. And therefore we fall even farther behind. So I do think, and I was going to kind of talk a little bit about it as we go forward, but I think also kind of having both that culture, but also having project managers that to a degree have a little bit of humility and a little bit of understand that there's going to be mistakes and there's going to be things, and having the folks that you work with understand that as well makes a project go so much easier.
It does. And a non-punitive environment where you
Correct.
it's not seen as a gotcha moment.
Yes.
We don't use the word failure. We use the word opportunity. I will correct you especially on a project team. If you say, well, we failed to do that. No, we have identified an opportunity where we could have done it better. That's all.
All great points. And I'm going to keep us on track because we have lots of things to go over. But all of this will tie together for everyone. These experts are bringing up fantastic points about, the scope and communication and why are you doing this? And you have to measure. And I love Ryan's point about people are protective of what they do. And if you're changing it, they don't like it. So you definitely have to manage that. So Ryan, we've seen various project management models, and Candy mentioned a few, Waterfall and Scrum, that are used in healthcare. Mm-hmm. Can you share a specific example of a project that you have recently led or oversaw, and what methodology did you choose and why did you choose it?
Yeah, so probably the best example, maybe not as recent, but the best is going to be when myself and a very small team adjusted and changed and redesigned our clinical funding models that pushes about $250 million in revenue and values physician services across 85 different specialties and subspecialties. So as you can imagine, especially when you get to begin dealing with the physician side of it, it can get a little sensitive. And I'm sure everybody has this organizational moment of everybody gets in a meeting. We all acknowledge we have an issue, and everybody's hand goes up and says, okay, if we could do just this one thing, we'd be fine. We'll just change this one thing and everything will be great. I've got the answer. Let's go ahead and move forward. And, given, to Jason's point, when you start getting into some of these complex issues and or sensitive issues, again, valuing physician services that are tied to their compensation certainly is sensitive. So what we did was we took a small step back and we said, okay, we need to put together a framework that's going to be pragmatic in nature. And so I have over the years, being from PwC in my former life, and I'm hoping there's no ex-PwC folks on here, or if there are, hopefully this methodology is old enough to where you won't try to bring suit against me. But I actually have adopted over the past decade their transform process. So essentially what it does, to Candy's point, is it breaks down change into manageable chunks. So the first thing we do is that we evaluate and analyze. We don't say, hey, this is what the future looks like. We go back and look at what the current state looks like. And then we go through kind of a design process to where we say, okay, if we know the issues here, we design things around that to help test that. Now, that's certainly an iterative process, as this was. But then we implement it, and then I think the most important part is going back and measuring it and analyzing it to make sure the program that you design or the change you design is doing what it's supposed to. So every meeting with every department chair, every executive administrator, any physician that wanted to join, we're starting at the beginning. This is not you've got the answer and we're just going to implement the answer. We're going to take a co-authored approach, and we're going to assess and understand what it is you need, what it is you have, what it is you want, and then design under certain assumptions and under some standardization where we could have it, but design something that fits the needs of each of those clinical departments and each of those subspecialties and specialties. And it really, to a degree, it changed the conversation because it put us all in the same spot, really in each increment in which we took this. So it ended up being, I think, very successful. And I'm not saying that just because I was a part of it, but we were able to roll something out that affected, 1,500 physicians in a little over a year. And so it continues to work. We continue to monitor the program. Half of my job is dedicated now to having those conversations on a monthly, weekly, daily, doesn't matter, whatever basis those departments want is when I get involved. And so I think that's also kind of been a little bit of a change in terms of the transparency and in terms of the flexibility in which we give them to address issues.
That's fantastic. So, Jason, I'm going to ask you next, and then I'm going to share a little bit on A3 methodology, which a lot of these methodologies have the same type ways of doing things, but I just want to show some slides and some resources for people to take with them. And if you guys have any resources that you can share and put in the chat, that would be great. So, Jason, same question to you. What are your methodologies that you like to use, and have you used one recently in a project?
So what I said about, the Deming model is most of the methodologies out there really are based a lot on Deming's work, right? That they ask those initial questions. What is it that we're trying to change? How are we going to determine whether this change is going to make the impact that we want? So it brings in all of the measurement, all of those pieces. I normally start there and keep it simple as much as possible. A lot of times I've seen methodologies used where everybody's doing so much work to maintain the methodology that they're not getting to the work of actually making the change. Mm-hmm. And I think that that's where you picked the wrong model when you're doing more work on the model itself than the actual change itself. So to me, it's keep it as simple as possible, use models that will work. But there are times where you have to consider, software models are great when you want to make functional changes. They're not always great when it comes to what if there's personal employee impacts that may change their lives. Sometimes those models don't take those things into consideration. So I like using, I mentioned influencer in my bio, that there's times where you have to understand that a change is going to have a massive impact to people, and you have to understand the social dynamic of that change. And to take those things into consideration, if you don't understand who the social leaders are and getting buy-in with social leaders within the organization, and that doesn't mean that those people have official leadership titles. They just are leaders from a social perspective. They can lead groups of people who will resist change or adopt change. And so I like to use that model, especially when we're dealing with something that has an impact to a large number of people, that it can impact their lives. It can impact the fact that there could be jobs that get reduced, things like that. I think it's important to use those models and not one size fits all.
So just a follow-up question to that before I show some A3 stuff that will tie in a lot of everything that you guys are talking about. So the Deming model, yes, a lot of things are built off of that. What would you say to a new manager who is trying to communicate? How would they go about it? And would they just go to the people that the change is impacting? Would they go to their leaders to garner some support, because a lot of project management, obviously, as the three of you have been saying, is communication. People are involved, feelings are involved. What advice would you?
So my advice would be not only just communicate to the people who are going to experience the change, but over communicate. Let other leaders know. That's a thing that sometimes there's collateral damage sometimes that happens because people work with other people. And as they're going through stress and as they're realizing impacts of a change, they share that with coworkers. Well, coworkers then have feelings for that other person, and they feel for their difficulties. And if they don't understand why the change is going on and they don't understand what the change is, sometimes they jump on the bandwagon and say, hey, why are we doing this? Why are you hurting these people, in a sense? And they don't understand how this matches in with your mission, vision, and values. So it's critical that everybody understands the change. And I say over communicate versus under communicate. Let other people know. We let other leaders know about changes that we're making in our part of the organization that they may never see any impact at all, but their employees could see the impact. And we need the feedback to know, hey, is the adoption of the change not just at a technical level, but is it also reaching the heart level, right? At the end of the day, we have a common system of beliefs that we share within our organizations. That's our culture. And we need to make sure that there's a change in the culture as well when we're implementing changes.
Great thoughts. And if anyone has any questions, please type it in the audience chat and we're happy to answer. I'm briefly going to go over, this is a book that I have used for project management before. It's called Managing to Learn, and it's the A3 methodology. And just briefly, I'm not going to go into detail on this because we don't really have time, but the A3 is just a lean process. It's a piece of paper. It's an 11 by 17. On the left-hand side, you put in the current information about what's going on with the project that you're working on. It could be denials, as an example. On the right side, you do the future state. I would have a piece of paper. I would do everything in pencil because it changed so often. As you start gathering data and going around and talking to people, it changes. So on the left-hand side would be your problem statement. So you understand how you're going to measure and what is the background behind that problem. You do current state analysis by pulling data. You will do a process flow to see if you're capturing everyone who's involved. You want to do root cause analysis. And there is a method to that called the Gemba. I don't know if anyone has heard of this, but this is one of the key things I learned from using this process was go around and talk to the people. It's not the people that are causing the issues. It could be their training. It could be the systems. It could be anything. But I learned a lot by doing that. And then you're going to set your target state measurable goals. And then you're going to do countermeasures, which are basically, here's where you are today. Where do you want to go? How are you going to get there? And you propose those countermeasures. And then you implement and go through. This is what it looks like, the left-hand side and the right-hand side. And the book, if you get the book, they have several different examples. Defining the problem, again, I think we've all talked about this so far, about being specific and using data and explaining the impact, the why behind you want the whys, correct? Analyzing the situation and setting goals. Again, the biggest thing here for me was doing the Gemba. And just a quick example, we had significant denials with Medicare and Medicaid. But anyway, it was a Medicaid denial. And I remember going to a team member and saying, why do you do this? And why? The series of whys. Why? And she said, oh, well, I don't look at those accounts because they take me way too long to get through. And in her work queue, she could pick the accounts she wanted to work. Well, she had a production quota for her to complete so many accounts in a day. So she would just constantly put these longer stay cases to the bottom. So she was never working them. So we did next in queue with our work queues as one thing. Another example that I saw was the hospital had to send electronically a bunch of data. Well, I asked them, why do you have to send it like this? And they explained. And then I'm like, are you sure that the Medicaid people are getting all of the data? And they're like, no, we just assumed they do. So I called Medicaid and I said, did you get the entire chart? And sometimes they're only getting half of it because they were long stays. But walking around and doing the Gemba will really help you understand what's going on and create those countermeasures. So also including people for brainstorming, action planning, selecting your solutions, and then the implementation piece. And as everyone has also said, checking your results. And Ryan's still checking results on some of his projects. So some key takeaways. So be very clear on the problem statement, do the Gemba, go around and ask some people. Don't assume you know the answer. I am someone that I think I know that what the answer is to the problem. And I think by implementing one or two things that it's going to fix it. Well, we don't know everything. You have to go and ask the people. And again, you can't blame it on any person because again, as everyone has stated, it is personal. There's people involved. So just keep asking them, why do you do it this way? Or why? Do your data measurement, work with everyone in the process, just as Jason was sharing and communicating, and celebrate your successes. I put some additional resources here. I can try and pop them into the chat, or Spencer said he's going to share the slides at the end. So anyway, I just wanted to share that quickly as something that I've used to learn how to manage projects. And I found very, very helpful. And the book was also very helpful. Anyway, so Candy, I don't know if you have anything to add there.
I do, because I do want to make sure that everyone knows that we are also not living Alice in Wonderland's dream, and that you always have time. Follow all of it. You know, when you're going through step by step, I'm thinking, yeah, there are times whenever there is a large enough cash impact in our organization and our revenue cycle, or where within revenue cycle, that administrative function that I kind of own the whole process. I will tell you that there is a time and place for change management where we make the change. We notify you of the change, and this is the way that we're going to do it. And you better get on board real quick because we don't have time. So I do want to make sure that we put that caveat out there. You have to, as a leader, I think that that's probably the largest contribution that I bring to any change that comes into this organization from a financial performance standpoint, is that being able to very quickly identify, what type of a change is needed here? Is this one that is a much larger project where we get everyone's opinion that has ever touched that or has ever been involved in the history of building that? Or is this something that needs to be a very tight, small knit group, and we need to very quickly get this analysis piece done and the definition in place? Like, I'm talking 48-hour turnaround to where we can immediately stop a forest fire. And so I think that that's really the trick, particularly in revenue cycle operations. I can't tell you how many other projects or teams that I've been on that you get invited to meetings, and it has got to be one of the most expensive meetings on the face of the planet, right? Where you have everybody, their brother, and like the neighbor's child that they babysit on Tuesdays and Thursdays on the call, and it is all unnecessary. There is an eighth of the people that are on that call that actually know enough to effectively manage the change and would be able to get it done a lot faster if it was not this cumbersome group. So it is definitely a balancing act. This is, a lot of people, I think that they hear change management and they kind of tune out and they're like, well, that's easy. We all have to make changes. We have to make changes every day. If you approach it that way, I can guarantee you that I'm a much more effective leader than you are. That's just what it's about. You have to be able to delineate what takes this longer, more fully vetted changes, and also the amount of labor that's going to take to mitigate that change, to, as you call it, babysit, but to effectively manage that change on the go forward. I think that that's key. And I think that that's really what delineates more effective leaders from making progressive, forward-thinking changes in their organizations.
So building on that, I'm going to go to Jason first, then to you, Ryan. So the rigidity of a structured methodology versus, Candy, you said just this change needs to happen now because we are losing a lot of money or whatever is happening. Jason, can you provide any real world, like how do you decide what type of project management you're going to set up? And obviously you have to be flexible in a healthcare environment because everything is constantly changing, it feels like. But can you give us some examples or why you would choose one method over another or even change midway through the project?
Yeah. So I would say always avoid changing methodology in the middle of a project. In my experience, if you have to change methodology in the middle of a project, you're talking about a project delay now. To restructure change management in the middle of a process normally means that, there's a delay because you've got whole other pieces that have to be reorganized when you're changing methodologies. But what I would say is normally I look at, again, it goes back to asking the questions in the Deming model. Like, what are we really trying to accomplish? How are we going to measure this stuff? As you look at that, that's what helps with determining kind of the change model. Sometimes there's really simple changes that for the most part, you've already got methodologies in place and they're pretty static and it's almost really process oriented. Now, there's a little variation. I mean, anytime you start up a new service line or a new clinic, there's some variation, but for the most part, you have those processes down. So you use that standard, you keep that, and you use those metrics. But then there's areas where you're innovating and you're doing something new. And so you have to look at various models of what will this model force me to do? Some of the things that you mentioned, Carol, like, Dan Heath calls it going and seeing the work. There's other models that talk about, Gemba walk, things like that. Sometimes you do have to go see the work, and that model is different than if you're doing other types of change. So I think that that's ultimately how you have to evaluate is if this is just a technical change that has to be made and it's not going to impact people's lives and their emotions or anything like that. It's just standard change. There's a lot of various models. The other thing you got to take into consideration is that sometimes you're using vendors and they have their own methodologies that they use, and they're used to putting stuff in on a regular basis. So it's also being flexible to adopt what other people use, because if this vendor's good at implementing stuff and this is their change model, I would rather use part of their change model and adopt pieces of it and be adaptable than try and teach them our model and then take another 6 weeks on the project.
Agree. Ryan, I cut you off a little bit, so go ahead.
No. I was going to say really two things. I think one, typically when I usually approach these, I mean, I try to put together, and I probably overuse the word, but I try to put together simply a framework. I mean, the reason I kind of do that, to Jason's point, is to give myself, quite frankly, a little bit of flexibility inside of each of those steps. And it really, to a degree, is simply a way for us to level set where we're all going to start. So we're all starting from the same place. And then, I think, Candy brought up a really good point in terms of effective leaders and change, regardless of what you use. You can call it the Gemba, you can call it Transform, you can call it whatever you want to call it. But I think what you're going to see in each of those, and I think we've seen it more and more of probably the past decade and a half, is this is where those really good soft skills come into play. So the idea of being able to manage people, to engage people, to get people understanding the why behind it, to be able to handle a project detractor as opposed to just, because not everybody's going to get on board going, yep, let's go that way. There's going to be some that are going to want to go sideways and left and right and up and down, and being able to manage those and having, again, I'll call it a framework rather than just kind of a step-by-step A1, A2, A3, gives you a little bit of flexibility when you get to those kind of snags. And then having leaders that have those softer skills that are able to kind of negotiate and overcome those things, I think is something that, to Candy's point, I can prove to you I'm a better leader than you to a degree because I have some of those softer skills, whatever those are for whatever organization you have. And then also understand, our organizations and our cultures are not the same. I mean, you've got to be flexible. To Jason's point, if there's already kind of an embedded way that people accept and process change, why would I come in there and try to hammer my way in there? Just use what they've already got. Use it in the context in which they find valuable and that they're willing to get on board with. Again, that's kind of that emotional intelligence and those softer skills that have been, I think, valued more in leadership than it has in the past.
So to that, and I'll laugh a little bit, but when I originally asked Candy to do this podcast with me, she talked about babysitting. So, and you mentioned it, Candy. So
I did. Well, it's nicer than the other. I call it no nose or other body part wiping. And
Yes.
I'm a little bit blunt about that. And I know that comes across really harsh. That's a portion of the changes that, I think a lot of us in healthcare and finance leadership, a lot of us are type A personalities, and particularly my generation, I'm Gen X, that in particular is, just tell me what you want done and we're going to figure out a way to get there. And then you don't have to worry about it because I'm going to self-monitor it. Not everybody thinks.
What are some key strategies that you use to get buy-in, though? That's what I want to know. How do you get people to adopt?
So my undergraduate's in theater. I will tell you this much, and anyone who knows me knows that I say this all the time. I am the world's most genuine person, but a lot of times it's in the delivery, and it's making sure that you're delivering the message to the right person in the way that they want to hear it, and understanding of that why. So you've got to be able to very quickly break down very complex problems. I know that we're all talking about change management like it's this simple thing, and you just do step 1, 2, 3, 4. It's not really that easy. You have to be able to interpret very complex issues with a lot of stakeholders and be able to identify where those gaps are and be able to present it in a manner that is going to be the most well received from that individual recipient. Some folks have an innate ability to do that. That's why I mentioned the theater degree. That has translated so beautifully. And when I was a young, dumb kid, I was just looking for a way to get my college education paid for, right? Somebody said, hey, we'll give you a scholarship, but you got to declare as a theater major. Whatever. I will declare as Captain Hook if that's what you want to get my education. Right? So, but I never realized at the time how valuable some of that skill set would become as a working adult in an office with. A lot of times we deal with personalities that are very process driven. They're very black and white. There is no gray. And with a lot of the problems that we're trying to solve and a lot of the gaps that we see in healthcare finance, they're not black and white problems. Mm-hmm. There's not just a singular switch that can be flipped. There are usually multiple sources of a failure or of something that's not being addressed. Every time a new regulation comes out, it's kind of like, oh gosh, okay, how are we going to do this? It's almost like we get the regulation before we determine, are we even able to meet the regulation? That happens all the time in this space, right? So babysitting is maybe harsh, or nose wiping is kind of harsh, but we do have to look for ways to hardwire that follow up on the process, that measurement of the process, that, just because you fix it once doesn't mean that it's going to be fixed.
And I do agree that you have to change probably how you approach the different types of personalities, as you touched on there. Maybe the black and white needs some data. Maybe the people that are very, this is my job, need to understand the process needs to change and keep up with the time. But I want to get into measuring performance improvement. So actually, I'm going to go to you, Ryan, first about creating actionable insights, relevant KPIs, and how you track performance improvement. Can you give some examples of that? And then I'll go to Jason.
Yeah. So, I think we joke around here. We're fortunate enough. We have a ton of information. We have numbers and quality measures, and we could go down to any level you want. But the challenge we have is taking that information, making it actionable, making it relevant and impactful to those that are using it, which in the past, we all revenue cycle wise, finance wise, we had those 5 golden things we always looked at. We looked at aging, and we looked at DNFB, and we looked at, all of those. Yeah, I believe you looked at all of those things. Well, the reality is that especially in healthcare, I figure I say it every year, but I always feel that we have never been as interconnected from the front to the back and everywhere in between as we are now. We are connected to the pharmacy in a way we never have. We're connected to our clinicians in a way that we've never had. And I think, having those golden rule things is no longer what we're trying to do. So what it forces you to do to a degree is it forces you to begin to look at, okay, what's impactful? What are those out of the box thinking kind of measures that point to the success or failure of a project that allow you to send it out and it has context for everybody? It's not easy, and it's not always effective, to blast it out to an entire group, but that really is kind of where we're at. I think I ask everybody the question first of, when all is said and done, what are the 3 things that we're going to look at to determine whether or not this worked? And some of it's going to be, well, we're going to look at, our surgical ICU is a great example. Well, let's look at bounce backs. How many patients came, we transferred to a step down unit that came back? Because that really is a measure of effectiveness of the ICU in being able to treat that person to where they can go down to a lesser acute setting. Because as we all know, we're getting paid a set amount, whether we get them out of there in 2 days or 8 days to have them in the ICU versus a step down. So, but bounce back is not something that necessarily relates to everybody, but it relates to that project. So I think when it comes to metrics, I think it's going to be a little bit of a project dependent thing, but I think we have to ask the question up front, what's going to be meaningful and what's going to be impactful and what's going to show that we succeeded, and how do we explain that?
Perfect. So Jason, I want you to give me some input on KPIs to track performance and some examples. And then Candy, I'm going to come to you about benchmarking.
Yeah, I think what Ryan said is absolutely true. KPIs are going to vary based on project, right? And going back to Candy, knowing that she's got a theater background, that makes a lot of sense, right? Because at the end of the day,
that's why we all love her.
when we're dealing with projects and we're dealing with things, we're really telling a story, right? And we have to make sure that we model that story according to our audience. So an example of just going and deciding, hey, we want to implement electronic statements. Why do we want to do this? Well, we've got patients who are calling in, and 50% of our calls to customer service are oftentimes that I want to make a payment over the phone and I want to make a payment arrangement. I don't have that option. So we create an opportunity to create electronic statements that make offers or allow people to do their negotiation online. That's a huge thing. And so a key metric for that is, how would I measure that? How do I know that's going to be success? Well, I'm going to see that my customer service calls for making payment arrangements are going to drop, and I'm going to be able to collect more cash than I did before, because now a patient, the story we tell is, I want to be able to make a payment arrangement at midnight when customer service is closed in my underwear at home. And that's my story. When we look and validate our story after we implement our project, our customer service calls drop. People are making payments any time of the day versus having to make a call at very specific customer service hours. So that's the kind of stuff where I think that's where we look at our KPIs enforce the story that we're telling as we implement our project.
Great points. Candy, I'm going to give you very briefly, tell me about benchmarking, and then I want to get into AI, and then we have a question, and then we're almost done.
Yeah, that's great. No, I would just say a lot of times, particularly in healthcare finance, we actually identify our opportunities, or as we said before, our failures, right? We identify a lot of our opportunity from the benchmarking that we're using, whether it's internal and external. So anytime that I don't have to recreate how we're going to measure something, it's likely better than if I have to go and ask for custom programming to measure something after, right? So we do try to translate those stories over into something that we already are measuring. If it, in last resort, is if we can't do that, then we try to develop an automated way to measure it. The last thing that you want to do, because this is a tip from me, because I'm all about process improvement. That tends to be what I have done over the last half of my career, is go in and look and see where do we need to make changes to have better performance. The last thing that you want to do is get involved in an environment where you absolutely understand the problem inside and out. You know what needs to be measured, but there's not a metric for it. So you create one. If you create it and it can't be programmed, you are going to be stuck forever doing that manually. So just a word of caution for those that are on, because typically the people who are bought into change management are the ones who listen to these webinars, not the people who we wish would listen to these webinars. So just saying, don't do that. Don't sign up for manual metric creation, because you're going to be stuck with it forever, or a member of your team is going to be stuck with it forever.
I will say HFMA has some good benchmark data. They've got some map data out there. People are looking for benchmarks on how other facilities are doing with specific measures. And there's probably a bunch out there, but let's jump into AI for the last few minutes here, and we'll get to the question. But are you guys using AI and machine learning because they're rapidly evolving to identify trends analyze data, predict future needs. Does anyone have any projects going on? I'll start with you, Ryan, then go to Candy, then Jason.
Yeah. So Candy I'm hoping will generally agree with this. So, my take on AI is a couple of fold. One, I do think it's coming. I mean, I think it is, and I think it's going to be beneficial. I think when we look state specific at Alabama and you look at the providers that are there, right now, AI is not necessarily on top of our list. Now, I will say that from a revenue cycle standpoint, we are certainly using what I'll call some of the more elementary type of AI. So again, we're using bots, we're using a little bit of that RPA stuff. But when we really start thinking about, AI as a strategy, we haven't necessarily gotten there yet, because I think we're just, a lot of our hospitals are simply trying to keep the lights on. I mean, that's just the reality. But, I think when we begin thinking about AI and it starts to hit kind of everyone's radar, I personally think it's going to be very important to look at it from a top-down standpoint. So again, AI can function in a lot of different areas. I mean, we've preliminarily looked at it in helping, not just from a rev cycle standpoint. I mean, it can help with efficiencies across finance. It can help with efficiencies across HR and the pharmacy. I mean, there's really no functional area it can't or doesn't touch. So I think if providers begin to look at it as a top-down strategy, as not necessarily a centralized, but kind of a centralized function at the highest levels, and looking at it globally and holistically, I think is going to be very important, as opposed to kind of going into these little areas and just doing these little one-offs. Because I think when you do that, you're going to end up losing kind of the connectivity that I think AI can bring across functional areas that allow you to kind of gain synergies across a number of different bases.
I agree. And I think machine learning and AI is very valuable, but you have to put guardrails around it. There's a lot of vendors that are getting into the AI space and making lots of promises that they can take your data and analyze it and improve things for you and spit answers back to you. Some hospitals are developing AI teams internally. I'm going to give the last word to Jason, and there are some questions that I want to hit on, and we've got 3 minutes. So
no pressure, Jason.
I have a computer science background, undergrad. So a lot of what's called AI today isn't AI. At the end of the day, I think AI is going to be very valuable, but a lot of it, the bots and stuff, those are scripts. We've been writing this for years. So I would just say that's a place that we need to delve into, but cautiously, because there's a lot for it to grow. It's not where it needs to be yet. So I would say be cautious with how much you invest in AI. It's more, let's watch it develop. That's really what we want to see too.
Thank you guys for discussing project management. A couple questions here. When choosing the best methodology to be used, do you think frontline workers must be involved, or just to be involved after choosing the model?
It really depends on the project, right? I mean, if your project is frontline focused, then get your leaders involved. Again, going back to influencer model, get your social leaders involved. You don't have to have every frontline worker involved, but you definitely want your social and technical leaders involved in a project early, because they're the ones that are close to the work. If you're not doing the job every day, you will make the wrong assumptions, or you will make the wrong decisions. So use the people that are close to the work.
Yeah.
Well, without really knowing what the project is, what methodology would you think about using?
I keep it simple. Like I said, Deming is where I start, because that almost every model is built off of it. Ask those questions first. From there, you can determine what you need to look at. But if you're going to get into innovation and stuff like that, you're going to use more detailed models.
Yeah, and again, I think this is kind of where culture comes in. I think this is where understanding how your people relate to change kind of helps guide you in what methodology you should choose. And and sometimes it's really just as easy as just taking a step back and get everybody level set, and then moving forward from there. But again, I think to Jason's point, I mean, you can go back to Deming, but you can, also, I think this is kind of where culture and understanding how your people work and how they relate to change comes into play.
Well, I want to thank you all for joining the Better Care podcast on project improvement. And hopefully you had some information that you can take away from our experts. Thank you, Candy, Jason, and Ryan. So appreciate you and all your knowledge that you have shared here today. And everyone have a great day. Thank you.
Thank you, Carol.
Thank you all.